The race to vaccinate is picking up speed in the U.S. as dangerous variants spread to at least 35 states. The Biden administration says it will send millions of coronavirus vaccine doses directly to pharmacies. The White House says this is, quote, an important component to delivering vaccines equitably. As of Tuesday morning, more than 32 million doses had been administered and more than 52 million distributed. The rate of infection has been falling over the last few weeks. The total number of cases in the U.S. stands at more than 26.4 million. More than 446,000 lives have been lost. Now, dangerous mutations are fueling new concerns of a possible surge in cases. Experts have their eye on the highly contagious strain first found in the UK. As a new study finds, it may have mutated again. Omar Villafranca begins our coverage in Fort Worth, Texas.
A stark new warning tonight on the nation's dire COVID crisis.
I think with these new variants, the one particularly from England, it's very possible in the next 6 to 14 weeks we could see actually the worst of the pandemic that we've had to date.
That UK variant is already in at least 33 states, and now it's started to mutate overseas, raising concerns current vaccines may be less effective against it.
Is there any sense of urgency, doctor, to at least get the first round of a vaccine?
Yeah. I can't emphasize in strong enough terms how important it is for as many people as possible to get vaccinated as soon as possible.
Pfizer announcing it's planning to study whether a third dose may be needed after 6 months to 12 months to be more effective against variants. And Dr. Fauci revealing today the CDC may recommend double masks.
When people tell me or ask me, should I be wearing 2 masks, I say, you know, if it makes you feel better to do 2 masks, the chances are you're going to get an enhanced protection, so why not go ahead and do it?
Tonight, the Biden administration is expanding access to vaccines by giving 1 million doses to more than 6,000 pharmacies starting next week, with more on the way. Walmarts in Chicago began vaccinating customers today. And in Texas, health officials are hoping to fast-track shots by turning Texas Motor Speedway into a massive vaccination site. For 3 days, cars will cram 16 lanes in the racetrack's parking lot, where officials plan to administer 1,000 shots an hour, 10,000 shots a day.
But how important is this region-wise?
This is really part of the race to herd immunity. Here, the goal is needles and arms.
This clinic will open back up for 2 more days this week, and already there are more than 160,000 people on a waiting list just to get a shot here. Health officials say if they get a large enough shipment of doses, they will open up the clinic again. Elaine?
Omar Villafranca, thank you. Dr. Dara Kass joins me now. She's an ER doctor and a medical contributor for Yahoo News. Dr. Kass, thanks very much for being with us. The coronavirus variant first found in the UK now has a new mutation, and experts fear it could make vaccines less effective. Explain to us how mutations work and why they could impact vaccines.
So every time a virus replicates, there's a chance it's going to mutate. And we've seen thousands and thousands of mutations for viruses all the time. And it's not surprising at all that this virus, with the amount of spread and the amount of time it's replicating, is mutating at a frequency we're now noticing. Every mutation doesn't matter. In fact, very few of them do. But if one mutation affects either how the virus enters the cell or how it resists our body's defenses, we can see that mutation take hold and become a prominent variant. That's what we're seeing. Now, just because it mutates once doesn't mean it won't mutate again. And so the idea that the UK variant is continuing to mutate is also not surprising. This is why it's really important that we continue to monitor the different variants, and we continue to do surveillance of the specimens taken all over the country to make sure that we're not missing any new mutations, even as we continue to take care of the ones we know about.
Well, several drug makers are now working on booster shots as these new variants spread. How do booster shots work?
So we already are dealing with a booster shot situation with the Moderna and Pfizer vaccines, where you're getting one shot and then a second one a period of time later. The idea between these new boosters would be that they would be preparing for the time where the vaccine would become less effective over a new variant. Not that it would not be effective anymore, but that our continuum of protection, where we believe that protection is conferred, would become lower than that. and we would give a new booster to get people back over to that line of where we think protection is guaranteed. It's really preparation. We're not there yet, but it is encouraging that our vaccine manufacturers and our pharmacies are working towards that scenario that we're not in right now. So we're not being reactive, we're being proactive.
Well, the FDA is expected to consider Moderna's proposal to increase the amount of doses in each vial. Do Pfizer and Moderna have different vial sizes, and why would the FDA need to approve this?
So the Pfizer vaccine has 5 doses in the vial. It has to be constituted when you get it, and the Moderna vaccine has actually 10 doses in the vial. There's this conversation about the 6 doses and 11 doses, but they are multi-dose vials. The idea here is that Moderna could put an extra 5 doses in each vial. But the concern is that every time you puncture the vial, you run the risk of contamination. But more importantly, those 15 doses have to be given out at the same time because of the refrigeration and all the other operational issues. So you need to make sure that you have 15 people right there to get doses at the same time, or else vaccine can go to waste. So we need to make sure that our operations are up to the challenge of having people in groups of 15 ready, willing, and able to get vaccinated if the samples come in vials that big.
Well, as you know, this pandemic has highlighted racial and socioeconomic disparities across the country. How are these inequities impacting vaccination efforts?
So we know that the systems that exist right now are embedded with racism and other inequities that have happened over our entire lives, over generations of healthcare. And that when we do nothing, when we don't address those inequities at the core, we're going to see that we're going to have an unequal distribution of anything, whether it's just health services, preventive services, or vaccinations. We're obviously now seeing a disproportionate representation of vaccinations going to white Americans versus Black and Latino Americans versus who's qualified and where it should be going. So we need to continue to add intention into our access, take care of those barriers to access, whether it's registration or community engagement, vaccine hesitancy, or just age. We may need to now change the age qualifications for people that are in higher vulnerability areas that maybe need more access to the vaccine. And I'm looking forward to seeing those qualifications and eligibility requirements be modified to match the moment and make sure that we're vaccinating as many vulnerable Americans as we can.
Well, Olympic gold medalist Shawn Johnson tested positive for COVID-19, and she's currently pregnant. Doctor, what have we learned until this point about pregnancy and the coronavirus? Are there any major concerns for pregnant women who may have contracted it?
So we know the American College of Obstetrics and Gynecology talks about how women who are pregnant are at higher risk for complications to their matched counterparts from the coronavirus. It's one of the reasons that the discussion around vaccination of pregnant women is so important, because it is a higher risk category. A lot of the complications of coronavirus, whether they are respiratory or vascular, can be compounded by pregnancy. So it's really important that we make sure that pregnant women who are infected have good access to care and are understanding when their symptoms need to be taken care of either in a hospital or by a doctor. The other encouraging thing, though, is that we know that protection is conferred, in utero. And once a woman recovers from the pregnancy, whether it is the antibodies crossing into the placenta or, more importantly, in lactation, that protection that the mother gets is now conferred to her baby in her body and then also outside.
Really important information, Dr. Dara Kass. Doctor, thanks very much.
No problem.